Every single day, someone just like you, someone who feels fine, someone who thinks they're healthy, is rushed to the emergency room because of a silent killer that's been creeping through their arteries for years. High blood pressure. It doesn't knock on your door. It doesn't give you warning signs. But it's responsible for over 670,000 deaths in the United States every single year. And here's the part that should terrify you. 2 out of every 3 adults over the age of 60 have it. That's not a small number. That's millions of people living on the edge of a stroke, a heart attack, or kidney failure, and most of them have no idea. But what if I told you there are 7 specific foods backed by real scientific research that can help lower your blood pressure naturally, sometimes within hours? And what if I told you that food number 7 is sitting in most kitchens right now, but almost nobody knows how powerful it is? I'm Dr. William, and today I'm going to walk you through every single one of these foods. Stay with me until the end, because what you're about to learn could genuinely save your life. Let me be very clear about something. High blood pressure isn't just a number on a monitor. It's not something you can ignore or hope goes away on its own. It's called the silent killer for a reason. You can feel perfectly normal, go about your day, enjoy time with your family, and all the while your arteries are under constant dangerous pressure. That pressure weakens the walls of your blood vessels, it damages your heart, it puts you at risk for stroke, heart attack, kidney disease, and even dementia. And the truly frightening part, most people don't experience any symptoms until something catastrophic happens. No chest pain, no dizziness, nothing. According to the American Heart Association, nearly half of all adults with high blood pressure don't even know they have it. And among seniors, those over 60, the rates are even higher. In fact, nearly 65% of people your age are walking around with dangerously elevated blood pressure right now. But here's the truth that most doctors won't take the time to explain in a 15-minute appointment. You have far more control over this than you've been led to believe. And that control starts with what you put on your plate. The foods I'm about to show you aren't experimental. They're not fads. They're backed by decades of research from institutions like Harvard, Johns Hopkins, and the American Heart Association. And they work. Before we get into the foods, I need to clear up some of the most dangerous myths about blood pressure that keep people stuck, confused, and at risk. Myth number 1, just cut out salt and you'll be fine. Yes, reducing sodium helps, but it's not the whole story. In fact, many people slash their salt intake and see almost no improvement because they're ignoring the foods that actually support healthy blood pressure. Myth number 2, you can't lower blood pressure with food. I hear this all the time, and it's completely false. There are specific compounds in certain foods, nitrates, potassium, magnesium, flavonoids, that have been proven in clinical trials to relax blood vessels, improve circulation, and bring down both systolic and diastolic pressure. Myth number 3, all fats are bad for your heart and blood pressure. Wrong again. Certain healthy fats like those found in nuts and seeds actually help lower inflammation and support cardiovascular health. And here's the big one. Myth number 4, fruit is dangerous because of the sugar. I can't tell you how many patients I've seen who avoid berries and bananas out of fear, when in reality the fiber, antioxidants, and potassium in fruit make them some of the best foods you can eat for blood pressure control. So let's stop the confusion right now. What I'm about to share with you isn't about deprivation. It's not about cutting everything you love out of your diet. It's about adding the right foods, the ones that science has proven can make a real measurable difference in your cardiovascular health. Let me take just a moment to introduce myself, because in a world full of health misinformation, you deserve to know who's giving you advice and why you can trust it. My name is Dr. William, and I've spent over 2 decades working with patients in the field of cardiovascular health with a particular focus on seniors and preventive care. I've worked alongside research teams at leading medical institutions, reviewed hundreds of peer-reviewed studies, and seen firsthand what works and what doesn't when it comes to managing blood pressure naturally. Everything I'm sharing with you today is grounded in science, real studies published in respected journals like the Journal of Hypertension, the American Journal of Clinical Nutrition and Circulation. I'm not here to sell you a supplement. I'm not promoting a branded diet plan. My only goal is to give you the truth clearly and practically so you can make informed decisions about your own health. You deserve nothing less. Let's start with a food that most people overlook, but that science has shown to be one of the most powerful natural blood pressure reducers on the planet: beets. Now, I know beets aren't everyone's favorite, But once you understand what they do inside your body, you might start looking at them very differently. Beets are rich in naturally occurring nitrates. And here's what happens. When you eat beets, those nitrates are converted in your body into a molecule called nitric oxide. Nitric oxide is one of the most important signaling molecules for cardiovascular health. It tells your blood vessels to relax and dilate, which lowers the resistance inside your arteries and brings your blood pressure down. This isn't theoretical. Multiple clinical studies have demonstrated that drinking beet juice or eating cooked beets can lower systolic blood pressure by as much as 4 to 10 points within just a few hours. One study published in the journal Hypertension found that participants who drank 1 cup of beet juice daily saw significant reductions in blood pressure that lasted throughout the day. Let me tell you about Margaret. She's a 72-year-old patient of mine from Ohio. Margaret came to me frustrated because her blood pressure medications weren't working as well as they used to, and she was worried about increasing the dosage. I suggested she try adding 1 cup of beet juice to her morning routine. She was skeptical, but she agreed to try it. 2 weeks later, when she came back for a follow-up, her systolic pressure had dropped by 9 points. Her doctor was stunned. Margaret still takes her medication, but now it's working better and she feels more in control. So how do you add beets to your diet? You can roast them, blend them into smoothies, juice them, or even buy pre-made beet juice from the store. Just make sure it's low in added sugar. Start small, half a cup a day, and build from there. But beets are just the beginning. The next food is something you probably already have in your refrigerator, and it's just as powerful. If I could get every senior to make one single change to their diet, it would be this. Eat more leafy greens. Spinach, kale, collard greens, Swiss chard. These vegetables are absolutely loaded with nutrients that directly support healthy blood pressure. Let's talk about why. Leafy greens are rich in 3 key minerals: potassium, magnesium, and calcium. Potassium is especially important because it helps your kidneys flush out excess sodium, which is one of the main drivers of high blood pressure. Magnesium helps relax the smooth muscle in your blood vessel walls, reducing tension and resistance. And many greens also contain nitrates, just like beets, which means they also support nitric oxide production. The research here is overwhelming. The DASH diet, dietary approaches to stop hypertension, one of the most well-studied eating plans for blood pressure control, emphasizes leafy greens as a cornerstone. Studies show that people who eat multiple servings of greens every day have significantly lower blood pressure than those who don't. One patient of mine, James, age 68, committed to eating greens at both lunch and dinner for 30 days. He added spinach to his omelets, made kale salads for lunch, and sautéed Swiss chard with garlic for dinner. At his next checkup, his diastolic pressure had improved by 6 points, and he told me he felt more energetic than he had in years. Here's the key: consistency. You don't need huge portions. A cup or 2 a day is enough. Add them to smoothies if you don't like the taste. Sauté them with olive oil and garlic. Toss them into soups or stir fries. Most people think greens are just for fiber or weight loss, but they're one of the most powerful blood pressure weapons you have. And speaking of kitchens, the next food has been used for thousands of years in traditional medicine, but most people still don't use it correctly. Garlic has been revered for its medicinal properties for over 5,000 years, and modern science has finally caught up to what ancient healers always knew. Garlic is a cardiovascular powerhouse. The active compound in garlic is called allicin, and it's formed when garlic is crushed or chopped. Allicin has been shown in multiple studies to promote the production of nitric oxide, just like beets and greens. But it does something else too. It inhibits an enzyme called ACE, or angiotensin converting enzyme, which is the same target that many prescription blood pressure medications go after. In other words, garlic works in a similar way to some of the most common BP drugs on the market, but it's a food. A meta-analysis published in the journal Maturitas reviewed 20 clinical trials and found that garlic supplementation significantly reduced both systolic and diastolic blood pressure in people with hypertension. But here's the catch: it matters how you use it. Raw garlic is the most potent. When you crush or chop it and let it sit for about 10 minutes before cooking, you allow the allicin to fully form. Cooking it immediately destroys much of the benefit. If raw garlic is too harsh for you, aged garlic extract supplements are a good alternative, and they've been used in many of the studies. Let me tell you about Robert. He's 74 years old and was taking 2 blood pressure medications when he came to see me. I suggested he add 2 cloves of fresh garlic to his meals every day, chopped and added to salad, soups, or sautéed vegetables. 3 months later, his cardiologist was able to reduce one of his medications. Robert still takes his medicine, but the garlic gave his body the extra support it needed. Now, if you're someone with a sweet tooth, you're going to love what comes next. Berries, blueberries, strawberries, blackberries, raspberries are some of the most delicious foods you can eat, and they're also some of the best for your blood pressure. Here's why. Berries are packed with compounds called anthocyanins and flavonoids, which are powerful antioxidants that improve the health and flexibility of your arterial walls. When your arteries are stiff, your heart has to work harder to push blood through, and that raises your pressure. Berries help keep your arteries elastic and responsive. One of the largest studies ever conducted on diet and blood pressure, the Nurses' Health Study, followed over 150,000 people for more than a decade. The researchers found that those who ate berries regularly, at least 3 servings a week, had an 8% lower risk of developing high blood pressure compared to those who rarely ate them. And it's not just about prevention. Clinical trials have shown that people who already have high blood pressure can see measurable improvements by adding berries to their daily routine. Now, I know some of you are worried about the sugar in fruit. Let me put that concern to rest. Yes, berries contain natural sugar, but they also contain fiber, which slows the absorption of that sugar and prevents spikes in blood glucose. More importantly, the antioxidants and polyphenols in berries far outweigh any concern about sugar, especially when compared to processed sweets. One of my patients, Linda, age 70, used to snack on cookies every afternoon. I suggested she swap them for a bowl of mixed berries. She was hesitant at first. She thought it would be boring, but she gave it a try. 6 weeks later, her blood pressure readings had consistently improved, and she told me she actually preferred the berries because they didn't leave her feeling sluggish. You can eat them fresh, frozen, or blended into smoothies. Add them to yogurt or oatmeal. A half cup to 1 cup a day is all you need. But wait, the next food surprises almost everyone, especially those who've been told to avoid it. For years, people have been told to avoid dairy if they're worried about their heart. But the research tells a very different story, especially when it comes to blood pressure. Low-fat dairy products like yogurt, kefir, and milk are rich in 3 critical nutrients: calcium, potassium, and bioactive peptides. These peptides have been shown to have ACE inhibiting properties similar to garlic, which means they help relax blood vessels and lower pressure. The DASH diet, which I mentioned earlier, includes low-fat dairy as one of its core components, and studies consistently show that people who consume 2 to 3 servings of low-fat dairy per day have lower blood pressure than those who don't. One study published in the American Journal of Clinical Nutrition found that increasing dairy intake was associated with a significant reduction in hypertension risk, particularly in older adults. Now, if you're lactose intolerant, don't worry. Fermented dairy products like kefir and Greek yogurt are much easier to digest because the fermentation process breaks down most of the lactose. There are also lactose-free milk options that retain all the beneficial nutrients. Let me tell you about George. He's 76 years old and never liked the idea of taking more medication. When I suggested he start having a cup of plain Greek yogurt for breakfast every day, he was willing to try it. He added some berries and a sprinkle of flax seeds, combining 3 of the foods we've already discussed. Within a month, combined with his other dietary changes, his systolic pressure dropped significantly. His doctor was impressed, and George felt more confident about managing his health naturally. The key here is low fat. Full-fat dairy hasn't shown the same benefits in research, likely because of the saturated fat content. Stick with low-fat or fat-free options, and you'll get the best results. Now, the next 2 foods are small, but they pack an enormous punch. Don't let their size fool you. Seeds and nuts especially, flax seeds, chia seeds, pumpkin seeds, almonds, and walnuts are absolute nutritional giants when it comes to blood pressure control. They're loaded with magnesium, which, as I mentioned earlier, helps relax your blood vessels. They're also rich in omega-3 fatty acids, which reduce inflammation throughout your cardiovascular system. And many of them contain plant sterols compounds that have been shown to support heart health. Multiple studies have demonstrated that regular consumption of nuts and seeds can lower both systolic and diastolic blood pressure. A study published in the Journal of Nutrition found that people who ate a handful of almonds daily experienced measurable reductions in blood pressure within just a few weeks. Flax seeds in particular have been studied extensively. One clinical trial showed that consuming 30 grams of ground flaxseed per day led to significant blood pressure reductions in people with hypertension, some of the most impressive results ever recorded for a dietary intervention. The key is consistency and portion control. A small handful, about 1 ounce, is enough. You can sprinkle ground flax seeds or chia seeds on yogurt, oatmeal, or salads. You can snack on almonds or walnuts. Just be mindful of portions because nuts and seeds are calorie dense. One of my patients, Susan, age 69, used to snack on chips and crackers every afternoon. I suggested she replace those with a small container of mixed almonds and pumpkin seeds. Not only did her blood pressure improve over the next 2 months, but she also lost a few pounds and told me she felt more satisfied between meals. Now here's the one that will genuinely shock you. It's sweet, it's indulgent, and yes, it's scientifically proven to help lower blood pressure. Yes, you read that right. Dark chocolate. But before you run to the store and buy a candy bar, let me explain exactly what kind of chocolate works and why. Dark chocolate that contains at least 70% cacao is rich in compounds called flavonoids, particularly a type called flavonols. These flavonols stimulate the production of nitric oxide in your blood vessels, which, just like beets, greens, and garlic, helps relax and dilate your arteries, lowering blood pressure. Dozens of clinical trials have tested this, and the results are remarkably consistent. A meta-analysis published in the journal BMC Medicine reviewed 42 studies and concluded that dark chocolate consumption leads to modest but significant reductions in blood pressure, particularly in people who already have hypertension. But here's the catch. It has to be high-quality dark chocolate, at least 70% cacao, and it has to be consumed in moderation. We're talking about one small square, about 1 ounce per day. Milk chocolate won't work. It's too high in sugar and too low in flavonoids. And eating too much dark chocolate, even the good kind, will add unnecessary calories and sugar. Let me tell you about Paul. He's 73, and when I first mentioned dark chocolate, he thought I was joking. But he was willing to try it. He started having 1 square of 85% dark chocolate every evening after dinner. 3 months later, at his regular checkup, his doctor noted a measurable improvement in his blood pressure. Paul told me it felt like he was cheating on his health plan, but the science backed it up. Look for brands that list cacao or cocoa as the first ingredient with minimal added sugar. And remember, moderation is key. This is a tool, not a free pass. Now, even if you eat all 7 of these foods, you could still be sabotaging yourself if you're eating the wrong things. Let me show you what to avoid. Here's the hard truth. You can eat beets, greens, garlic, berries, yogurt, nuts, and dark chocolate every single day, but if you're still consuming these hidden blood pressure enemies, you're working against yourself. First on the list, processed meats. Bacon, sausage, deli meats. These are loaded with sodium and preservatives like nitrites, which can raise blood pressure and damage your arteries over time. Next, canned soups. Even the ones labeled healthy or low fat are often packed with hidden sodium. A single serving can contain more than half your daily recommended limit. Pickled foods and condiments like soy sauce, ketchup, and salad dressings are also major culprits. Then there are frozen dinners and prepackaged meals. Convenient? Yes, but they're sodium bombs. And finally, many so-called diet foods are actually loaded with salt to make up for the flavor lost when fat is removed. So what do you do instead? Choose fresh or frozen vegetables over canned. Make your own soups at home. Use herbs and spices instead of salt. Choose fresh meats over processed. Read labels carefully and aim for foods with less than 140 milligrams of sodium per serving. Small swaps make a massive difference. If you're serious about lowering your blood pressure, you have to protect the progress you're making by avoiding the foods that undo it. Now let's bring it all together. Here's what a simple blood pressure-friendly day of eating might look like. For breakfast, a bowl of plain Greek yogurt topped with fresh blueberries and a tablespoon of ground flax seeds. That's 3 of our power foods right there. Mid-morning snack, a small handful of almonds or walnuts. For lunch, a large spinach salad with roasted beets, grilled chicken, pumpkin seeds, and a drizzle of olive oil and lemon juice. That's greens, beets, seeds, and healthy fats. Afternoon snack, a small square of dark chocolate. Yes, really. For dinner, baked salmon with garlic roasted kale and a side of quinoa. Add a handful of fresh strawberries for dessert. Notice how easy this is. You're not following a rigid restrictive diet. You're simply choosing foods that support your body. You're combining flavors you enjoy with ingredients that science has proven to work. And here's the best part. You don't have to do all of this at once. Start with one or two foods. Maybe add beets to your weekly routine. Swap your afternoon snack for berries. Build from there. Consistency beats perfection every single time. Now I want to hear from you. Which of these 7 foods are you already eating? Which one surprised you the most? Which one are you most excited to try? Drop your age and your story in the comments below. Tell me what's working for you or ask me a question about your own blood pressure journey. I read every single comment, and I often feature the best stories and questions in future videos. You're not just watching a video, you're part of a community, a global family of people who refuse to let age or diagnosis define their health. We're all in this together, and I want to hear your voice. And if you found this video helpful, please share it. Send it to a friend, a family member, a neighbor, someone who needs to hear this. You could literally save a life today. Let's recap. Today you learned about 7 powerful science-backed foods that can help you lower your blood pressure naturally. Beets for their nitric oxide boost. Leafy greens for potassium and magnesium. Garlic for its ACE-inhibiting properties. Berries for flavonoids and arterial health. Low-fat dairy for calcium and bioactive peptides. Seeds and nuts for omega-3s and magnesium. And dark chocolate for its delicious heart-healthy flavonoids. You now know more about food and blood pressure than most people will ever learn. And that's not just information, that's power. The power to take control of your health. The power to make informed choices. The power to protect your heart, your brain, and your future. High blood pressure doesn't have to be a life sentence. It doesn't have to control you. With the right foods, the right habits, and the right mindset, you can fight back naturally, safely, and effectively. So here's what I want you to do. Pick one food from this list, just one. Add it to your next meal, then build from there. Small steps lead to big victories. You are worth the effort. Your health is worth the effort, and I'm here to help you every step of the way. Before we finish, I need to say this clearly. Everything in this video is for educational purposes only. It is not intended as personal medical advice, and it should not replace the guidance of your own physician. If you have high blood pressure or are taking medication, please consult with your doctor before making significant changes to your diet. That said, I encourage you to have an informed conversation with your healthcare provider about the foods we discussed today. Now, if you want more evidence-based, senior-focused health content like this every single week, hit that subscribe button and turn on notifications. I'm Dr. William, and my mission is to help you live longer, stronger, and healthier. Thank you for watching. Take care of yourself because you're worth it.